Sorry, busy sending emails here and I forgot the time. I apologize. It looks like we do have a quorum, so I'd like to call the July meeting of the County Legislature's Health Committee meeting to order. Rebecca, can we take attendance?
Sure, Mr. Chairman. Ray Joyce.
Present.
McLaughlin. Beston.
Yep.
Petto.
Present.
Miller is excused. Robinson. Ward. Collins.
Here.
And Lockhart. You have a quorum.
Thank you, Rebecca. Okay, under previous business, number one, a motion to approve the previous meeting minutes. Motion made by Mr. Beston, second by Ms. Petto. Any all in favor? Aye. Any opposed? Unanimous. Number two, the public hearing, this has been withdrawn, I understand? Okay. Number three is withdrawn as well? Number four, we have local law number I, which will be tabled pending the public hearing. And under current business, first up is our health department. Number five, amending the 2024 Department of Health budget, public health, strengthening infrastructure, workforce, and data systems funding. Good evening.
Good afternoon. We'd like to request legislative approval to amend the budget to allow us to use $35,000 for the 2023 Public Health Infrastructure Grant to fund a health and wellness stipend for employees who work through the COVID-19 pandemic. This is retroactive. The expenditure aligns with the allowable categories, which include efforts to enhance public health staff retention and job satisfaction.
Thank you. Do we have any questions from the committee? Okay, hearing none. Motion made by Mr. Beston. Do we have a second? Second by Mr. Ward. All in favor? Aye. Any opposed? Thank you. Next up is our Department of Mental Health. I think Dr. Giordano is here. Number six, amending the 2024 Department of Mental Health budget, overtime.
Good evening, Mr. Chairman.
Hey, good evening.
I'm here again with one of our associate directors, Michael Fitzgerald. And the first item we have is requesting to transfer $50,000 from 3 vacant lines in our budget to help us with our overtime costs. If you remember, in previous years, I've come to you multiple times during the course of the year. This time, I think we projected a little better. We're coming to you later in the year, and we're hoping that we won't have to actually expend all this money by the year's end, because we put some things in place in terms of creative ways of getting people on staff. But right now, if we were running at the vacancy level we're at, we would need $50,000 of this transferred money to cover our overtime costs to get to the end of the year. So we're asking permission to adjust the budget to do that.
Thank you, Doctor. Do we have any questions from the committee, Ms. Lockhart?
Thank you, Doctor. Is it creative ways to get staff?
Yes.
My interest, what creative ways
Well,
to get staff? What's happening?
I didn't mean to be cryptic, but I didn't know if you wanted to know. Well, one of the things we've done is we've brought 5 or 6 clinical staff in on a per diem basis to cover some of these overtime shifts for us. The problem with putting them right on the street is that there's a training for our emergency services that still hasn't been completed yet. And we have some interviews lined up for staff to fill the vacancies. We're running right now. We have 3 vacancies at Mobile Crisis and 2 at our court program. And as I've mentioned previously, these are great programs, and the people who do it are committed and dedicated. It's hard to find people who want to work overnights doing crisis work, for example. And so we are constantly trying to mitigate this. And if we're fully staffed, we would not need the overtime funds. And I hope that the next 6 months will increasingly show us getting closer to that goal. But right now, we have to anticipate for the worst, so that's why we're transferring money.
Do you anticipate using the per diem people for whatever length of time? There's no, and also, where do you get the per diem people from? Like, I'm used to the nurses. They come from many agencies.
Well, there's been a lot of people who have worked for us over the years who have left us from other places in the community. and they like the work, and
Yeah.
you know, so we have many connections.
Good, that's a lot of good experience.
It is.
Good, okay.
It is. Thank you.
Thank you.
Thank you, Patty. Do we have any other questions from the committee? Hearing none, can we get a motion to move? Motion made by Ms. Lockhart, second by Mr. Collins. All in favor?
Aye.
Any opposed? Unanimous. And lastly, number 7 tonight, amending the 2024 Department of Mental Health budget, expanding clinical services.
I'm joined by Joshua Bean from the County Exec's office. This is I think hopefully you'll agree, a creative proposal to bring mental health and addiction services to some of our veterans and people with military experience. So this is a proposal, and Joshua, please kick me under the table if I need to. This is, we're asking to transfer $70,878 of March On money that is in the County Veteran Services Bureau to the Mental Health Department. And for the rest of this year, our goal is to seek and hire 2 mental health addiction peer specialists to join our clinical services. The key here is that we're looking for people who have had lived military experience, so they can join us in our clinic, at our jail, on our mobile team, in our health home, to give us more credibility, I think, in helping veterans who are in need of mental health services. And we hope that this will extend into next year. This request is really just to get us through the end of this year. So the request is $70,878, which would get us 2 peer specialists through the end of the year.
Thank you. Do we have 2 identified for these roles already, or?
No, I wait for your approval before I...
Right, how will it work after it's approved? Will there be a posting for the job or position?
Through the standard.
Okay, any questions from the committee? Okay, hearing
I
none.
think it's a great program to have somebody with the experience.
I'm sorry?
I think it's a great part of the program to have someone with experience, military experience.
Well, there's a lot of evidence to suggest on the addiction side and the mental health side that peers who have gone through successfully recovered from whatever they're struggling with can help others.
Right.
And that should apply here as well.
Yes, absolutely.
Yeah, peers, especially among veterans. So, hearing no other questions, we have a motion to move. Motion made by Mr. Collins, second by Mr. Ward. All in favor?
Aye.
Any opposed? Unanimous. Thank you.
Thank you.
Can we get a motion to adjourn? Sorry, Ms. Lockhart, second by Mr. Ward. All in favor? Aye.